I'm Alan Wardis, and you're listening to ThinkRadio.
Chinese medicine views the body as a garden. It's something that is meant to be cared for and tended, and it needs a lot more input.
That's traditional Chinese medicine practitioner Katie Dautrich in our recent conversation about the science and philosophy behind the world's oldest healing system. Stick around for this episode of ThinkRadio.
ThinkRadio is supported by the Gunnison Country Times, Gunnison's locally owned hometown newspaper, and by listeners like you. To find out how you can become a ThinkRadio supporter, visit kbut.org.
Katie, thanks for coming by today.
Absolutely. I'm very happy to be here.
Let's start off by talking in generalities, because when we say something like traditional Chinese medicine, either people's eyes glass over or they have some kind of idea what that means, but maybe it's right and maybe it's not. So when you say traditional Chinese medicine, and you're a doctor of this, what do you mean?
Well, I'll give you the quick elevator speech, right? The quick and concise answer to that.
That's probably all we have time for.
So traditional Chinese medicine is a comprehensive health system that is the most consistently used medicine for the last 3,000 to 5,000 years. So it uses the body's own innate healing abilities and herbal medicine to help create a healing response in the body. So it's very much a natural medicine. It's all very much earth-based, but it also is very much human-based.
Meaning that the patient has to participate in this process. You don't just go get a pill and...
Yeah, there's no magic pill or magic cure for anything.
Yeah, it's a process.
Exactly. We've got to get all systems on board to make any kind of lasting change. And acupuncture, I think, is again a very comprehensive medicine in that it is bringing the body into a homeostasis so that the body can heal itself. And then if it needs that little extra push, there's also the internal medicine and the herbs that come into play that can help bolster the body.
And so the philosophy underlying this that is so different from what we think of as Western medicine is this idea of homeostasis. And what is it that you're bringing into balance? And the answer is qi, a life force that traditional Chinese medicine sees as permeates the human body, flows through it. What is that concept and how does it relate to what you do on a daily basis?
Yeah. So there's this really wonderful imagery that I love regarding Chinese medicine versus Western or allopathic medicine, where allopathic medicine refers to the body or sees the body as a machine. There's all of these working parts, and it's more robotic. Whereas Chinese medicine views the body as a garden. It's something that is meant to be cared for and tended with a lot of care, and it needs a lot more input. So life and health is a matter of cultivation. It's not we're living our lives in this robotic sense. We're all a part of the great machine. That's just a completely different view. And I think living in that Western world, we're much more attuned to that because it's the theory and the philosophy that's been ingrained in us because in the Western world, that's how we live.
We think that about everything.
Right. So when you're coming from that mechanic point of view, there's no reason to take care of yourself. There's no reason to cultivate a healing lifestyle because you just go to your mechanic and get your parts fixed.
Your water pump goes out, you get a new one.
Exactly.
Okay.
So in Chinese medicine, there's much more education that comes along with it on how to better cultivate health in your own life so that you are more responsible for your own health and your own well-being, really.
Well, I love that image of the garden because biologists are learning more all the time about how the natural world is really one system.
Exactly.
You can't go into a garden and just address soil or microbes or water or access to sunlight. It's all one big thing.
Exactly.
And so in what ways, though, does Chinese medicine go about assessing whether the garden is healthy or not?
Sure. So there's the obvious external signs and symptoms that you will experience. I've got an arrhythmia in my heart, or I've got a lingering cough, or I've got allergies, or any number of things. I have pain. There are specific diagnostic methods that are taught in this tradition, being a pulse diagnosis, in which you are tapping in and listening to all of the different energy systems in the body so that you can really isolate where the root of the issue is and maybe what that root is affecting.
Because it's not always obvious. It's not always a real clear-cut correspondence.
We are very complicated animals, and there is never a quick cut and dry solution to any health issues that we have. Our bodies are just too complex for that.
That's really not something pharmaceutical companies want you to know, is it?
No. What pharmaceuticals companies are good at is looking at the traditional herbal remedies. Let's take aspirin, for example, right? You're taking this plant that has been used for thousands of years to help with pain and to help with circulation and to help with all sorts of other things. And they're isolating the chemical that they feel or that they research that is the active component, and then they put that into a drug and then they give it to you. But it's all the other components of that plant. It's all the other constituents. It's everything that is that plant that's creating that health response. It's not this one tiny isolated chemical that's providing benefit.
So even the remedies have to be looked at holistically.
Oh, absolutely.
Wow.
Yeah.
But some would argue that there's a time and a place for that there are times when the pharmaceutical approach is what is needed.
Absolutely.
How do you work in conjunction with that idea and other practices from traditional medicine?
Yeah. So it's a little bit harder because there's a lot of herb and drug interactions that really need to be addressed and thought about. Like if a patient is having, so let's say you're on blood thinners for whatever reason. Blood thinners interact with herbs in a way that most Chinese herbs can't be used in conjunction with blood thinners because
there are complicated reasons for that
there's a lot of different
you have to take
interactions.
into account.
Yeah. So it's really hard to marry a pharmaceutical and an herbal approach. It's doable in a lot of instances. I just gave the most extreme one. But oftentimes, like if someone is on psychotropics, if they are
and an
on,
antidepressant, for instance.
Sure. There's a lot of herbal remedies that can be used in conjunction to take away any side effects that those pharmaceuticals might have and to enhance the effects of it at the same time. So they can really marry together nicely, but the practitioner needs to be really trained and be able to recognize what drugs can and can't be married together.
So the point is that it's not all that easy for these two things to work hand in hand.
At least internal medicine-wise.
Okay,
In regards to acupuncture and the physical medicine of traditional Chinese medicine, they go hand in hand amazingly.
Which brings us back to the question of qi, because herbal medicine can still be seen as kind of, a biochemical intervention. But qi is something different. I mean,
very different.
So explain that to us.
Sure.
How does that work?
So I'll kind of give a quick definition of qi. Many people will describe it as the body's energy force. It is the body's intelligent metabolism. It's the body's ability to communicate intelligently with itself.
Between systems.
Yes.
Yeah.
So let's say an analogy could be a power station. We have these big giant power stations where electricity is being generated, and then it's sent through these wires to houses and buildings and the community. So qi is the powerhouse. It is what is collecting all of these different materials from the outside world.
Food, air, sunshine.
Exactly.
Okay.
Turning it into the energy that we use downstream, our telephone and our internet or whatever travels through wires these days.
Yeah.
So that's another good analogy. It's just the intelligent organization of our bodies.
So it both gathers stuff that we need and distributes it.
Yes.
Okay. Hey, that's pretty cool.
Yeah.
Now, on the allopathic medicine side, researchers over and over and over and over again have said, yeah, that sounds really good, but there's no empirical evidence to support the existence of this system in the body. Now, you studied for 3 years?
3.5.
Three and a half years to become a doctor of traditional Chinese medicine. What is your answer to that?
Our science is not yet up to par to be able to tap into those subtle energies. We're kind of just now getting into the realm of quantum physics, and I feel that that's where the huge scientific breakthroughs are going to happen, is when we can really tap into the quantum physics field. That's where all of these subtle energies are working. And I actually just read a statistic that about $10 million a year is being spent on acupuncture research because the benefit is being seen, but nobody knows how it works. So there's a ton of money being thrown at it, but our scientific systems just can't delve in deep enough because it's more subtle than these gross tests.
Right. Well, that's interesting because it suggests that these aren't simply incompatible. It's just that we haven't quite figured out how to measure the things that are at work.
Right. And we have measured some of them, like biophotons are something that science has fairly recently been able to address. And in some circles, biophotons are equivalent to qi. So some people might say that we have definitively been able to actually find and measure qi. Again, that's a quantum physics thing, and not everybody's on board with that.
Well, and there are some structural reasons for some to resist this. Because, let's be honest, if your approach is to say to a patient, look, you just need to take care of yourself, getting some exercise and eating right and keeping balance as much as you possibly can, and then we'll intervene when we need to, there's not a whole lot of money to be made in that.
You're right. The allopathic medicine route, that's where all of the money is made. Obviously, there's not that much money to be made in traditional medicines. I don't feel that health should be something that needs to be profitable, right? Health is something that is innate in all of us, and there shouldn't be a number associated with that.
Yeah, and if my appendix goes on the blink tonight,
you're not coming to me.
I'm going to be really happy that the emergency room is there.
Absolutely.
And that those people are really good at doing what they do.
Yes.
This is not to say it's an either-or proposition.
No.
But the fact that allopathic medicine has tended in the past to ignore some of this holistic approach has created some problems, including things like the profit motive taking over and playing a bigger role than it should. Are you seeing any evidence that allopathic medicine is sort of catching up and integrating some of this stuff? Because I've done stories on behavioral health, for instance, and they use words like holistic and integrated and wanting to treat the whole person. Are you seeing this as well?
So much. So I believe that the population is starting to recognize that allopathic medicine doesn't have all the answers. And people are starting to reach out and grasp for all of these alternative and complementary medicines because they're not fulfilled with their doctors and with the care that they are getting or not getting, as the case may be. And I do feel like the allopathic community is stepping up. For instance, Gunnison Valley Hospital just started this last year the Integrative Therapies Department. And we have acupuncture and massage and Reiki and healing touch and all of these wonderful alternative modalities
on site
now
at the
available
hospital?
at the hospital.
Wow.
I mean, we're a very health-oriented community. And the doctors are starting to see that. All of their patients are starting to ask for alternative modes, and now the doctors are having to seek that out.
And are insurance companies starting to catch up also?
Yeah, absolutely. Most insurance companies these days will cover acupuncture, massage, and chiropractic. Some will cover orthobionomy. Other more subtle energy work like Reiki and healing touch isn't usually covered. But just over the last couple of years, there's been huge leaps and bounds in the insurance game on what they will cover. And that has a lot to do with the opioid crisis that's been going on.
Really? Connect those dots for me.
Sure. So opioids have been overprescribed for many years, and it's leading to lots of obvious addictions and deaths. So the Joint Commission, which is basically the governing body of all hospitals in the United States, has basically put out a statement as of 2018 that all medical facilities must have alternative therapies to opioids.
In other words, pain reduction therapies.
And that's also starting to be true of insurance companies. So doctors will now be given more bonuses with certain insurance companies if they first are prescribing alternative care, and if that doesn't work, then they can prescribe the opioids.
That sounds really good. That sounds like a step in the right direction. Is it working? Are alternative medicines and complementary medicines actually functioning to do this, to reduce the amount of opioids that are being prescribed?
I think it's probably too early to definitively say that because that rule was just enacted January of this year.
Really? Okay.
But as far as what I see in my own practice and what I'm seeing at the hospital, absolutely, it's helping. Doctors don't need to prescribe medicine, the opioids, these tragically addictive drugs, when they can easily write down on their prescription pad a 60-minute massage once a week for 3 weeks.
Mm-hmm. And that's effective? People find that? I mean, obviously not in some cases. If you've got a really serious injury, maybe that's not appropriate. But for some of the more chronic things, acupuncture can relieve pain.
Absolutely. So acupuncture uses the body's opioids. Like we all have our own opioid type hormones and drugs inside of our bodies. Acupuncture has been proven to release those hormones and painkillers in the body. So there is still an opioid response in the body, but it's your own. You're not having to interject these toxic chemicals to get a pain relief.
So we're back to patient participation. You got to want that, believe that it's possible, I suppose, and go get it.
Yes.
Huh.
You don't even have to believe it.
Yeah, okay. All right.
Acupuncture has no placebo. It has a little placebo effect, but it works much more than just that.
Really? Yeah. Well, that's interesting. I mean, everything else has a placebo effect.
Acupuncture does have a placebo effect, but there are some that argue that acupuncture is strictly placebo.
Right.
And that's not true. Placebo effect doesn't work on animals, and acupuncture has been shown to be effective for horses and cats and dogs for joint pain and very noticeable effects.
Huh, okay. Well, so what about the other aspect of the opioid crisis, and that is treatment of addiction? Because once we get into this problem, now we've got to figure out a way to get out and help the people that have sort of fallen into this trap. Are alternatives effective for addiction treatment as well?
They are, and actually I am currently in the works of creating a smoking cessation program to treat addiction that way. But there are certain protocols in acupuncture that have also been proven to be very effective for treating addiction. And it started back in the late 70s, early 80s with the cocaine crack epidemic in San Francisco. And there's been a lot of progress with that in creating protocols to treat addiction with acupuncture.
And presumably that also involves kind of a holistic approach. So you're also introducing things like diet and exercise.
Absolutely. And mental health counseling and all of these different therapies work really well together. And they are shown to be more beneficial when you're using all of these different modalities together.
Well, and so that brings me to a topic that fascinated me the first time you and I ever met. Mm-hmm. And that was your assertion, and with your practice you've been proving it, that traditional Chinese medicine and acupuncture are effective in mental health disorders.
Yeah.
That's not something that I would have intuitively thought. People think of acupuncture and think, okay, that's pain relief, that's moderate my allergies or something like that.
Sure, yeah.
Describe to us how acupuncture can be effective in a mental health disorder like, say, schizophrenia or chronic severe depression or something like that.
Let me just state that acupuncture has been shown to be as effective as talk therapy. So if you have mild depression or anxiety, something that can be easily treated with just kind of a generic talk therapy counseling session, mm-hmm. you can get those same effects with a couple of needles or some herbs. For the more severe disorders like manic depression or schizophrenia or anything that kind of falls in those lines, acupuncture can be used in conjunction with mental health to create a faster result with less side effects. So I don't really ever suggest if somebody is schizophrenic or bipolar or whatever and they're on pharmaceuticals to help treat that, I don't suggest that people get off of those necessarily unless that's something that they want to do. But acupuncture and Chinese herbs and other therapies within that realm can really benefit the therapy that they are getting.
In what ways? How?
So by bringing the body into homeostasis, we're looking at the whole mind-body-spirit connection. Some people may have anxiety or depression because their energy is stuck somewhere in their body. There are areas of stagnation that create these responses, and oftentimes they create an emotional disease.
Because you can't experience something in the body without having a feeling about it, right?
Yes, we are emotional creatures. Everything that we do, everything that we see, everything that we experience on any level will affect us emotionally. And if we don't know how to process it, if we can't process it, then we start to get more and more diseased. We fall into these disease patterns and, you might get panic attacks or you might have crippling depression. And acupuncture works, again, to just create this homeostasis and open up lines of communication in your body that can relieve some of those symptoms. It can lighten the load. I mean, when I was in therapy, I hated it. I hated giving my feelings to another person and expressing all of that to someone else and being that vulnerable. And there's a lot of people that feel that way. So if they can do that on their own terms, if they can just come and lay on the massage table, get a couple needles and just chill out for 30, 45 minutes and have the same amount of processing happening.
Mm-hmm. That's attractive to a lot of people.
Absolutely.
How did you get into this business? I mean, what's your story? Why would you choose traditional Chinese medicine? You could have gone a lot of different ways. Mm-hmm. We've already said there's a lot more money to be made in other kinds of medicine.
Yes.
But you chose this. Why?
When I was younger, I wanted to be a nurse or a doctor. I've always had that healing spirit, I guess. But just like many people, I kind of fell out of love with the Western medical model. I just felt there were some flaws that I didn't agree with and I couldn't really get on board with. And just through kind of my own research, I came across some traditional medicines, and just with how old traditional Chinese medicine is.
Which is an interesting point. Let's make a point of that, because you said it's like 3,000
3
years.
to 5,000 years old. Yeah.
Something doesn't stick around that long if it doesn't work.
Exactly. It is the most consistently used traditional medicine.
Mm-hmm.
Nobody knows how or why it works. That's what we're trying to figure out.
Mm-hmm.
But it does. And like you said, nothing will last that long if it doesn't. And that definitely appealed to me. I think the thing that drew me in the most was the herbal medicine aspect. I love the idea of using what the earth gives us as medicine and just utilizing what we already have to heal ourselves.
The earth's alternatives have also stood the test of time, you could say.
Yeah. And they're not alternatives. They're the primary. They are the original.
Okay, busted. You caught me.
I'm guilty of that too. It's alternative to our modern culture.
Yeah. I developed an interest in herbal medicine when my kids were young.
Mm-hmm.
Partly because I just didn't like the idea of taking the lid off of a bottle without knowing what was in it and feeding it to them. There were times, of course, when that was the appropriate thing to do, but I remember some of my family members, scoffing at feeding my kids leaves and twigs. And at first I thought, well, wow, when you put it like that. But then it occurred to me, wait a minute, that's how my ancestors had to do things.
Mm-hmm.
They didn't have any choices. So
Right.
It's not as crazy as it sounds.
It's not.
How do people engage with traditional Chinese medicine? I mean, clearly you're there, you're in the phone book, you're on the internet.
Mm-hmm.
How do they find you and what's going on?
Sure. So, I'm not the only one.
Right. There
There
are
are
many.
quite a handful of acupuncturists in the community, and they're all marvelous. I have office hours at my clinic throughout the week, or they can call the hospital and contact Eva Paul, the Integrative Therapies Coordinator.
And Eva presumably would hook you up with lots of different
Absolutely,
options.
yeah. If you wanted to get in touch with a massage therapist or orthobionomy, or if you wanted to try Reiki, Eva could help you out with.
Okay. Are there any events coming up or health fairs or things where people can come and learn more?
Sure. The Wellbeing Connection, which I'm also associated with, is a community organization that works in partnership with the hospital. And they will be putting on a summer solstice event on Friday, June 22nd.
Beautiful.
And there will be a ton of practitioners there to talk with and experience different types of modalities and just learn about what's going on in the Integrative Therapies program and other alternative practitioners that are in the community.
And where will that take place?
That's going to be on the hospital campus.
So watch for that. There'll probably be some advertising coming up.
Mm-hmm.
You can learn more about all of these things at this summer solstice event.
Yeah.
Katie, it's always awesome to talk with you.
Thank you.
Think Radio is a production of Alan Wardis Media. To contact Alan, visit alanwardismedia.com.
Thanks for listening. Join me next week for another great conversation on Think Radio.